Hello, it is Friday, March 20th, 2015. My name is Josh Evans, Vice President of Government Relations for IARF. And you guessed it, it's the IARF week in session. And what a busy and trying week in session it has been. We started the week off this week by spending some time up in Chicago with the Senate Appropriations 1 Committee to provide some oral and written statements on the impact of the Department of Human Services proposed fiscal year 16 budget. IARF staff was joined by literally hundreds of advocates, other provider organizations, etc., providing some rather clear information to members of the Appro Committee as well as the department as well on what we all estimate to be the impact of the proposed budget. Most importantly, the association was in a position to present the data that members gave us from our survey the week before last, in which we told to the committee very specifically by cut area what the impact would be. On the aggregate, based on 60% of members responding to the survey, we estimated that over 51,000 children and adults with intellectual and developmental disabilities and serious mental illnesses would either experience severely restricted access to services or would lose services entirely under the proposed budget. Much of Acting Secretary Bassey, DHS Secretary Bassey's statements during the hearing centered around the fact that this budget gives them the flexibility that they need to do to preserve core and essential services, a statement that the association respectfully disagreed with. As I don't need to tell many of you, with the cuts that were proposed, particularly with the GRF grants in areas such as respite, epilepsy, autism program of Illinois, sorry about that, and on the mental health side with the elimination of several grants, including psychiatric leadership and the cut to the special projects grant. We just don't see an environment in fiscal year 16, should these cuts stand, where the provision of community mental health and DD services as we know it would continue. The fight will continue, though, however, as the House Appropriations Human Services Committee took up statements today, or rather Thursday, on the proposed DHS budget over in the House. Ran from about 8 until noon, and unfortunately we all ran out of time before the panel was able to get to the proposed budget in the areas of DMH, DASA, and DDD. We think we're going to be able to resume those conversations with the House on April 1st up in Chicago, and we also were told by the chair, and we can expect this over in the Senate as well, that there will be some additional hearings throughout the state in the coming weeks and months on the proposed budget to give advocates, families, individuals the opportunity to talk about the impact. Much more interesting and concerning is what's going to happen with the remainder of the current fiscal year, FY15. Lots of discussion in the State House, although no agreement has been struck yet. Likely an agreement could be struck as soon as next week, but as you folks know, there are a lot of shortfalls facing the budget, particularly child care, Division of DD, facing a shortfall in mental health, early intervention, child care assistance, Department of Corrections, court reporters are shortfalls all over the place that impact the state in many different ways. Proposal on the table now is a 2.25% across-the-board Medicaid cut, as well as some reductions in across-the-board GRS spending that is currently being looked at by the leaders and currently being looked at in the governor's office and currently being looked at by rank and file members of the General Assembly. We don't believe the system can absorb a cut of this nature, especially given the remainder of the fiscal year, and as you know, we've asked all advocates to flood Springfield with calls. If you've made your calls, please make them again, and thank you for that. If you've not made your calls, I strongly encourage you to call your reps and state senators down in Springfield and tell them the community cannot absorb a cut. Any cut we take now in the FY15 budget further compounds the damage that we have estimated would occur should the FY16 budget move forward. Don't have to tell any of you that we've not had an increase across the board in community DD services since 2008. We haven't had an increase in the mental health fee-for-service rate since 2006. As a longtime advocate in our community has said, the community system is like an old bike tire that's had the air let out of it slowly over time. It's now flat and the system is stuck. We need to shift the conversation back to investing in community care. We need to address DSP wages. We need to address mental health rates. In order to do that, we need to address revenue as well. So continue your advocacy, folks. I'm going to wrap up by a promise and a commitment we made with the last IARF week in session, and that is an interview with a random person at the Illinois State House. I am pleased I was able to catch up with Representative Kelly Cassidy from the 14th District in Chicago yesterday to ask her a few questions and get her feedback. So we're going to move on to that segment. Once we're done, we'll wrap up, and you bet you'll hear from us next week. Super excited to be here this morning for this new segment of IARF Session in Review with Representative Kelly Cassidy from the 14th District.
Okay.
Just going to do a couple questions really quick.
Sure. First question is, you chair the new Juvenile Justice and System Involved Committee. What are some issues you think the committee will tackle moving forward?
It was real important to me that this not just be a juvenile justice committee, that it includes system-involved youth, because I think that as a state, as a community, we have to recognize the fluidity among the various systems, that many of the kids in the shelter care and DCFS and abuse and neglect system end up in the juvenile justice system and vice versa. And I think that any solutions we look to have to recognize how very fluid the barriers between those systems are. So I'm looking forward to having some good conversations. It's an interesting makeup, the committee, reflecting a pretty broad swath of the state. So I think that the conversations, in particular as we delve into things like the shelter care system and questions around how we operate our juvenile justice system, are going to be really great. And hopefully we'll make some positive changes in both systems.
So, on the campaign trail, and certainly with some decisions he's outlined through executive order today, Governor Rauner seems committed to looking at criminal justice in the state of Illinois and doing some things differently. Do you see opportunities to work in a bipartisan fashion with the administration on some of these issues?
I do. Honestly, having worked on restorative justice issues for many years, it was already becoming a great bipartisan conversation. There is a growing awareness, even among the formerly tough on crime wing of both parties, that many of those policies have actually done more harm than good and have brought about more costs than savings. So we've had opportunities to make changes around sealing of records and issues like that. There's a growing willingness to look at even our sentencing structures and even our charging decisions, and I'm grateful for that. At the same time, I'm a little concerned as I see, on the one hand, he's formed this great commission, and the governor is talking about criminal justice reform. He's also slashing the very programs that make those things possible. I had a fairly contentious hearing yesterday with the head of the Criminal Justice Information Authority, asking why, if in fact these are his priorities, the governor's priorities, why all of the violence prevention funds are being eliminated, why bullying prevention funds are being eliminated, why the programs that provide, the only program that provides meth treatment in Southern Illinois for youth is being completely defunded. So there is a little bit of, how much sense does this make? And I would like to see actions match words. And I'm hopeful that maybe as we work down the road on this budget, it's going to make a little bit more sense.
Okay. I think that's an excellent segue into the next question. Knowing that the association that I work for represents mostly not-for-profit community developmental disability and mental health service providers, everything you just said is certainly of interest in terms of incarcerating individuals with mental illnesses and what are the steps we can do to try to scale that back meaningfully. So very encouraging to hear what you said there. By now you've had a chance to kind of look over some staff analysis of your own, and you just indicated, particularly when it comes to criminal justice, the governor's introduced budget. There are a number of cuts that were put out there in terms of cutting community DD and mental health services. Based on kind of your review and how you reflect back to services that are provided in your district, what are your thoughts on some of those proposed cuts, and do you think that there is maybe a chance to walk back from them this General Assembly?
Well, we have to, ultimately. I made reference to penny wise and pound foolish cuts. The things you're talking about are glaring examples of that. When we're talking about community-based care, it is cheaper, it is more effective, it is better care. When you're talking about the DCFS wards that are 18 to 21, if we cut off services to them, you might as well just deliver them directly to the county jail. These are kids without any other resources. And even just some of the Medicaid cuts. The things that we corrected that were originally cut from the SMART Act, we corrected them because they cost us more money. Ultimately, he is the governor. He proposes the budget, but we actually have to craft it and vote for it. And I simply don't see support to pass a budget that makes these devastating cuts. At the same time, I still haven't found enough support for the revenue needed.
That was going to actually be one that didn't have on the list, but I was going to propose for discussion. What is your stance on? Do you think the General Assembly should look to additional revenue, or is there a willingness, you think, to address a revenue question? Remains to be seen. What's your position?
Well, I don't know that there are very many people in this building who've worked harder to raise revenue. Whether we're talking about the progressive tax or the millionaire tax or simply not rolling back the income tax like we already did. We have to do something. These programs have already been cut to the bone. The idea that the Republicans are saying we're not going to discuss revenue until we make cuts, we've already closed prisons, we've already closed juvenile justice facilities, we've already closed reentry facilities, we've already closed centers, we've cut to the bone. And I'm not saying there's never more places for cuts, but services cannot be cut anymore. We are already bleeding, and that has to stop. And we can't pretend that we haven't made cuts. We have. It's time to talk revenue because the cuts have been made.
Well, thank you. Thank you for those important statements, and certainly on behalf of the association, again, thank you for your leadership last session and advancing an increase to the personal needs allowance, which was a big deal for individuals with disabilities across the state.
Absolutely, and honestly, just the right thing to do.
And thank you for your time today.
Absolutely.